I'm Nikki Hillier. I'm with the Champaign-Urbana Public Health District. I'm a program coordinator there, and today I'm going to talk a little bit about CATCH, one of the efforts that we're implementing in the community locally. Our objectives for today are to develop an understanding of what CATCH is, the premise behind it, and how schools are implementing it locally. And then we're going to talk a little bit about some of the evaluation studies behind CATCH. CATCH is a method of implementing many of the components of coordinated school health. Coordinated school health is a model developed by the CDC that includes 10 different pieces. Those 10 pieces are health education, PE and physical activity, nutrition environment and nutrition services, health services, counseling, psychology and social services, social and emotional climate, the physical environment of the school, family engagement, and community engagement. When you look at CATCH, it addresses many of the components around coordinated school health. There's a classroom component that addresses the health education piece. There's food service that addresses the environment of the cafeteria, but also the food and the services being offered to students, and also looks at snack policy. There's a physical education component, a family piece, and then all of this is brought to the community, so there's that component as well. And the staff are modeling these healthy behaviors, and so there's also that staff component. CATCH started because we wanted to see how we could reduce the obesity trend. The premise behind CATCH is that our environment influences our behaviors. So we didn't get here by making individual choices that have nothing to do with our environment. Our portion sizes got bigger and bigger. We would never choose an 8-ounce soda for 45 cents because a 64-ounce soda is 50 cents. We made it so that those are the best decisions, that those are the easiest decisions for us to make. Why wouldn't we refill our free popcorn bowl at the movie theater? So the premise behind CATCH is that we need to change the environment so that we make it easy for people to make good choices. There is a teaching component. We're teaching the kids to get regular physical activity and eat healthy foods, but we also want to change the school environment so that they don't see a vending machine that has a Pepsi advertisement on it, that they see teachers modeling healthy behaviors, and that we're also changing the family norms. Everything that the students learn at school is also getting sent home so that parents learn how to shop and prepare foods in a healthy way, that they have ideas for things to do during school breaks when it's cold in the winter. How can families be active together? And it's really a coordinated effort. So it's not just, oh, the PE teacher is implementing CATCH. There is a piece for everyone to help with CATCH. The physical education component, the real goal behind that is that kids will be doing moderate to vigorous physical activity for at least 50% of that short time that they're in PE. The kids don't get a lot of time in PE, but the time that they do get, we want to make sure that they're getting that moderate to vigorous physical activity. 50% of the time might not seem like a very big goal, but there's a lot of instruction and management that has to go on. There's a lot of schools don't have enough equipment, so students are sharing equipment. So it is really difficult to get kids to move at least 50% of the time. We want to make sure that students are given a variety of opportunities to participate, that students of all abilities are able to participate. So there's no elimination games. A lot of times we remember in school when you got tagged and you were set out. With CATCH, we make sure that kids, they may get tagged and eliminated, but they just go to the sideline, do some kind of activity, and they get back in, so that we're utilizing that short time that they do have doing PE. There's a classroom component that tries to incorporate things that students already need to learn, like counting, figuring out higher and lower, measuring, and they put sort of a healthy twist on it. So when you're working on measurement or fractions, you might look at cups of fat or teaspoons of sugar that are in different things. There's graphing activities that look at sugar-sweetened cereals and how many grams of sugar are in different types of cereals. We really want students to not only focus on learning the activities, but there's also modeling that's done so that students learn from watching, and they get they get the opportunity to also practice. So we might do something like, if we were going to plan a healthy party, what kinds of snacks would you have? What kinds of activities would you have? And they get the opportunity to kind of practice that. The family program is, part of it is newsletters being sent home. In the earlier grades, we don't put a lot on the students, so we do send a lot of newsletters home so that parents just learn the vocabulary, they know what's going on. But in 3rd, 4th, and 5th grades, they're actually doing homework with the students. So the activities may include walking the dog together as a family, looking at labels together as a family. So not only is the student learning, but the whole family is learning as well. And a lot of the cues that we have at school, we also have at grocery stores and in the community, so they're reminded all over. We also do a family fun night so that parents have the opportunity to do some hands-on learning. It's great that they get these materials sent home and they get to do these activities, but we also try to have an event where parents can learn how to make a healthy meal or pack a healthy lunch or try some new physical activity. Another component of the program is the Eat Smart program, and that is really with the food service. There's a lot of pieces to purchasing, planning, preparing, and promoting the meal, and this component really works on promoting the meal. So all of our schools adhere to the National School Lunch Standards, but we want to make sure that that when kids get all the foods on their plate, that they're choosing the best ones. So there's a lot of promotion that goes around promoting the go foods is what we call them. So with Catch Nutrition, the language around that is go, slow, and woe. Go foods are pretty much fruits, vegetables, non-processed foods, fat-free milk, non-flavored milk. So we tell kids, these are everyday foods you can eat. You want to eat mostly go foods, and then slow foods are foods that may be a little bit more processed, like applesauce with sugar, or peanut butter foods that may be higher in fat, sugar, or salt. And then woe foods are the foods that we should say woe to. They're reserved for special occasions and celebrations, cookies, cupcakes, chips, things like that. And you should try to eat the least amount of woe foods. An important part of Catch is that there's no foods, and so it doesn't eliminate foods from anyone's diet. All foods fit. Another part of Catch is staff wellness. Because the staff are talking to the kids about go, slow, and woe foods, and they're saying that woe foods are reserved for special occasions and celebrations, it's important for them to model it. Students will notice that disconnect. We've had students at schools that are learning about go, slow, and woe foods, but when they get to breakfast, it's a big honey bun smothered in frosting, and they know that that's a woe food. It's for special occasions and celebrations. Breakfast isn't a celebration. Or they hear teachers talking about how important it is for them to eat more go foods and slow foods and woe foods, but they always have a can of pop in their hand. So students will notice the disconnect between what teachers are saying and what they're doing. So we try to support staff in any health behavior changes that they're making, any health initiatives they're taking on. There's a lot of studies to support the effectiveness of Catch. Most of the studies either compare a control school to a Catch school. Some studies have looked at Catch before and after. The initial studies that looked at Catch found that the students that participated in Catch compared to those who didn't made changes in the way that they ate and the amount of physical activity they were getting, and the food provided at the school shifted. They stopped the intervention at 5th grade, because at the time Catch was only available for K through 5. And then 3 years later in 8th grade, they followed up with the students, and what they found was that many of those health changes that they made were sustained even without further intervention. A lot of Catch studies have demonstrated an increase in vigorous physical activity during the school day, but also after school, on weekends, and during after-school programs. They watch less TV, they have less screen time, and that kids who go to Catch schools have shown improvements in test scores because physical activity is tied to improved test scores, attention, and other academic improvements. The other reason that we chose Catch is because it's a coordinated approach. It doesn't say that you, the PE teacher, or you, the principal, are going to take on this effort. It's a coordinated effort. There's a role for everyone to play. There's a role for parent leaders. There's a role for the youth at the school. There's roles for the school nurse, the PE teacher, classroom teachers, specials, the art teacher, the cafeteria manager. So everyone has a role in this effort. It doesn't leave anybody out and also requires all of those people to take part. Every school has a catch team. The most effective catch schools have standing meetings monthly. So those catch teams are solid. They meet enough and they interact enough, do enough planning that they do have a really good catch effort at those schools. Some other tools that are available, there are folders. So every person that has a role has a folder that really explains exactly what you need to be doing the first 6 weeks, the second 6 weeks. So it may be hang a poster, send a newsletter home, cover some lessons, do a healthy eating contest or a healthy recipe contest. And so that those efforts, while they're separate, they're coordinated in that everybody's kind of working on the same theme. So that support is coordinated too. So that's why those monthly meetings help. We ask that schools that are going to participate in CATCH help with assessments. So we want to be conducting our own evaluations. One thing that we do is we screen the whole school for BMI. We also do a school health index, which is a tool developed by the CDC that looks at all of those pieces of coordinated school health, and the school team evaluates how the school's doing in each of those areas. That is a really helpful process because it's teachers, administrators, parents, everybody all in a room kind of assessing how the school is. So while the teachers may say, bullying's not a problem, we don't see it, a parent can say, well, actually, these are some of the things that my student has been coming home and telling me. So we get all different perspectives when we do that school health index. We do take a look at their wellness policy and see what kinds of changes we need to make there. And then all of the staff have to go through a full day training. They get CPDUs to participate, but sometimes that's a challenge to get that time away from the classroom or to ask teachers to participate in that long of a training. We ask that they implement the CATCH curriculum in PE and in the classroom. We ask for a CATCH champion who's pretty much the chair of the wellness committee, and then we ask for assistance with quarterly reports so we can just keep up with them and help with data collection.